Great. So now you're going to get into the detail of that for the folks in this room. And what I'd like to ask each of you to do from your perspective and your experience is talk about what are the skills, what is the educational background, what is the work experience that healthcare employers, or if you prefer to talk about academic programs, what are those requirements and expectations that employers and academic programs in healthcare have when they're looking at candidates?
Well, I can start. Okay. Some of the employers that I work with, as far as the academic needs, again, we offer associate degrees as well as master's degrees in OT. So I looked at some job descriptions that I have from employers, and I wrote down some kind of key things that they're asking for. And I was glad for the student panel, you guys brought up professionalism a lot. That was #1 on the job description. These employers want professionalism. They want strong interpersonal skills, pleasant personalities, because you're dealing with patients and coworkers. They also want strong attention to detail and good math skills. One of the things the employers ask is you have to be able to convert inches to feet. And I mean, in all your math classes, why do I need to know that? Because employers are asking you need to know that. So it's a basic skill, but it's really important for employers, and they mention it. Obviously, medical terminology is on a lot of the job descriptions. Strong computer skills, Word and Excel, being accurate when entering data. We're getting into a technology field with healthcare. It's permeating in every aspect of healthcare. You see your doctors coming in now with laptops, and they happen to put information in. And then the assistants, when you leave, are putting information in a computer. So computer skills are very important. And being able to multitask. One of the students brought up multitasking. That's a phenomenal trait. And you can earn that in any area of employment. So even though you're working at maybe a McDonald's or a convenience store, you're multitasking. You're dealing with computers, you're dealing with the phones, you're dealing with different things. So that's a transferable skill that folks can bring for every job, but it's important in the healthcare industry. And also clinical experiences. A lot of our healthcare programs have clinical experiences, and my employers like that. When they say I want someone with experience, they mean internships, clinical experiences, and that's something that you have in the healthcare programs. And I'm sure many of you do that. That's it's worth its weight in gold, what you do in your clinical experiences. So those are some key things that I pulled out of actual job descriptions that come into my office.
Get up.
Glad I could help you out.
I got to tell you, one, I think Pat touched on most of the ones that I had there. I think there was one missing. You need to have your license. Okay, so you have to have a license in whatever specific discipline that you're going to work in. The other thing you touched on, attitude. That's a huge thing. At where we work, we say we hire for attitude, train for skill. Okay, so attitude is everything. And just to use like a Rhode Island term, we want people who are wicked smart. That's who we want to come work with. Because one of the things that I didn't hear, the only thing probably Pat didn't say was change ready. Change ready. So, by the way, when you come to work at Care New England, I can guarantee next year the way we operate is going to be different. And not only do you need to be change ready, but change is accelerating. So people who don't like change, you're going to have a difficult challenge in healthcare. Also, Pat had mentioned work experiences. We look at that. People have done different things, not just school, even though school is quite a challenge, and maybe had done some type of caring experience. So that might have been caring for other people, elder care, the daycare. You help other way where you help other people outside of school. That shows that that's the kind of attitude and the kind of person that we look for to come care for our patients. So that I know there's a lot of educators in the room. I know that as educators, you put the student at the center of everything you do. In healthcare, we put the patient at the center of everything we do, and we serve the patient. So people who have the mindset to serve others, those are the kind of people that we look for. And through fantastic service, you see great leaders come of that. So those are the kind of attitudes and skills. Those are hard to pin down. Trust me, we had tests to find that out. But because we use a lot of behavioral interviewing, I'm sure that you guys talk about that when you're helping to place students. A lot of behavioral interviewing goes on. So we have specific behaviors and competencies that we're looking for different roles. So the competencies that I want for a high-end accountant are different than what I want for a caregiver or an RN who's going to help deliver babies. But we will interview based on those competencies. Yeah, I know you already got your RN. I'm not worried about that. I know you know how to deliver a baby. We want to see what the attitude is, how you're going to engage with our patients, how you're going to be part of the whole patient care experience, how you're going to be part of the team. Because one of the biggest parts about healthcare, the key thing you need to know is healthcare is a team sport. There's no I in healthcare. So we can't run healthcare without each of the individual pieces working in harmony together and all working in an interdisciplinary way. That is not often what we see that changing now, but a lot of times just the way we've educated and prepared students is more within each discipline. But when you get to the hospital, everyone's got to work together. So much better to be educated and prepared that way before you show up to the workplace.
I'm just going to piggyback on some of what Mike was just saying about interdisciplinary studies. A lot of the colleges now are starting interdisciplinary practice. This is a movement of the Institute of Medicine really pushing this. The physician needs to know how what the nurse does affects his job. The nurse needs to know what the pharmacist does and how that affects her patient. And they need to know what the housekeeper does, and the housekeeper needs to know how they clean a room affects the safety of that patient. So understanding that big picture team, even at orientation at Rhode Island Hospital, when you first get hired, you have to do something called the big picture orientation, and it's with everybody that got hired within that month or so, all the way from the surgeons to the guy who hauls the stuff in off the truck in the laundry department. So it's a great, hospitals, health centers, colleges are doing a really great job at that. At Stepping Up, we, with the help of the Governor's Workforce Board, Rhode Island Foundation, several other funders, we partnered with the Rhode Island Action Coalition. They're running a nurse residency program this year. This is one of the few in the country. It's a cutting-edge program for newly licensed nurses. We're training them in the Nurse of the Future core competencies. So we've been studying a lot about what these skills are of the Nurse of the Future. So they're doing 6 months of hands-on clinical rotations in 4 different locations, and they're coming in every Friday to the URI downtown campus for a seminar from faculty members. Some of them are safety and infection control. The more complex our viruses and diseases become, the more we have to be aware of how we're preventing that. Evidence-based practice is another skill, understanding why you're administering that med, why you're manipulating a patient in a certain way. Read, and know why you're doing what you're doing. That's an important skill for any caregiver. Communication, I mean, it sounds like a basic skill, but if you all hear the stories in the newspaper of someone amputated the wrong leg, I mean, those things happen, and that's because there wasn't. You don't want that to be you, and you don't want to be a person in that operating room when that happens. So if you see something, speak up, and employers want to know that you're willing to have that confidence to say something to someone who's, got 5 degrees more than you do. Informatics, Pat mentioned that, computer skills obviously with the electronic medical records, now being able to, if my record is going to be viewable at my obstetrician, at probably my son's pediatric office, at Rhode Island Hospital, Women Infants Hospital, it'll all be accessible in one central location, so learning how to navigate those databases. Mike talked about leadership. That's a big skill we're working on in the nurse residency program. Understanding reimbursement models. Healthcare is a business. They're trying to make money too, and you are at the front end of that as a healthcare provider, so you need to understand what you're doing, how much that's going to end up costing the patient, because they might want to know that from you. And the billers over at your employer side are going to want to know how can you save them money, or how is all that working together. So you need to be able to understand reimbursement models. Behavioral health, complex, multiple diagnoses. Just talking with the now retired director of the emergency room at Rhode Island Hospital. More and more people are coming into the emergency room with multiple diagnoses. It's not just for a hip fracture. It's Alzheimer's, with Parkinson's, with a hip fracture. It's someone with alcoholism, multi-personality disorders, and got in a car crash. You need to know how to manage those multiple diagnoses with a really complex patient. Rachel, where's Rachel? She's on the student panel. You talked about being able to think on your feet and act really quickly. That's a critical thinking skill, very, very important in any setting, whether it's working in a home care setting, at a health clinic, or at a hospital. You need to know how to analyze, think, and produce some sort of an action within a matter of seconds. And the last thing I'm going to add are cultural competency, bilingual skills. With more diverse populations being seen, we want our healthcare workforce to reflect the patient population. If you have bilingual skills, you're going to be, a few points ahead of other applicants. So it's another great thing to understand.
And being the last person on the panel, I agree with everything that has been said. But as in nursing leadership positions for majority of my career, and hiring registered nurses, one of the things I look for is the BSN. And on top of that would be, are there any specialty certifications? Now, as a hirer of certified nursing assistants and medical assistants, I'll tell you some of the things, and you had said, is critical thinking. And how I assess that in an interview is I give scenarios. And I want to see that people can actually, I ask a question and give a scenario, because it's so very important to be able to take pieces of information, data, and process it, and then really problem solve. So that gives me a lot of insight on how you have to think quickly on your feet.